I'm gonna do that really quick. Okay. So we have a new scholar with us on tonight. So everybody is going to introduce themselves and then we're going to get started, right? Okay. So my name is Olympia. I'm an MHI scholar. I've been working with MHI since 2020. I primarily work with data, but I also do a lot of other things. I'm also working on creating an app for MHI, which is currently in production. And we'll have more updates about that soon. And I also do a lot of presentations and a lot of public advocacy type events. So yeah, do we want to hear from maybe Glemmy?
Hi, my name is Glemmy. So I help produce this podcast. This is the Journal Club podcast. We do this on a weekly basis. I'm a college student. I go to New College of Florida. I'm an art major with a stat minor. And I help with graphics and communications here.
Mo?
Hello, I'm Mariah or Mo. I'm currently a student at New College. I just joined MHI like this past month, not this past month, like at the end of May. And right now my AOC is sociology, and I'm really excited to like be at Journal Club and like do interviews and stuff and like talk with you guys.
And Johnny?
It seems like Johnny will be right back. So
okay.
It seems like he dropped out the call really quick and will return.
Okay.
With that being said, I think we could all get started. So
I'm sorry. I didn't mean to interrupt you. Do we want to hear from Olivia?
Oh, of course.
If you're comfortable speaking. No, it's okay. I just wanted to, I think this is the first time I've met you. So if you're comfortable, just saying a little bit about yourself, I would be curious to hear about it.
Hi, my name's Olivia. I go to Sarasota High School and I'm just visiting Journal Club.
Cool. Awesome. That's really, I'm actually very excited about that. That's really cool. I hope that you learn a lot about, working in this type of organization and the way that we kind of like foster, I don't know, what's the right way to say that? Intellectual conversation. Is that the right way to say it? I don't know. But, intellectually informed conversation. So yeah, Glemmy is going to be leading this meeting. So I'm going to mute now and let Glemmy take it away.
So again, to reintroduce what this all is. So this is the Journal Club podcast. This is a MHI Multicultural Health Institute projection. And we talk about articles on a weekly basis in addition to interviewing guests. These guests typically help within their own communities or have some sort of medical background, it seems like. With that being said, today we will be talking about brain trauma injuries. I read an article that spoke about not the misinformation, but rather how brain trauma isn't necessarily something that people either don't take seriously, or it's more so of like, it's really hard to recognize. A really good way of breaking down how misrepresented brain trauma is, they kind of set it up on this particular scale that's like mild, moderate, and then very serious, which that's not the best scale to represent brain trauma just because of how brain trauma develops over time, right? So even if you have a minor injury, it could cause bigger problems over time. And with that is obviously there holds a lot of complications, right? When you label something as like mild or moderate, and then what you really consider serious. And like when serious stuff heals a lot better than moderate or mild things. It's really important to recognize like the groups of people this typically will impact. So let's think about our veterans, anyone in the military possibly, who have to do a lot with either physical activity or possible incidents, athletes for sure. From a personal background, as a student or a prior student athlete, I remember taking these courses to be educated on brain trauma and heat strokes before every season, before I was even allowed to like played the sport. So to me, reading this article was kind of a little bit mind-blowing because I thought people knew more about it, because you hear about concussions and how serious they are and whatnot. But even then, there's still little representation as to the approach on how people should deal with brain trauma. With that being said, again, it was like a really good analogy that I read within the article was that there's no such thing as like a mild case of cancer, you know, like cancer is cancer and brain trauma is brain trauma, and they should all be equally treated as seriously. So I thought that was a really interesting analogy because I never thought about that way, because even then, even in those courses that I had to take for several years within my high school experience, they all said to treat it the same, but they never like gave that analogy that really like highlighted the importance, right? So I thought that was really interesting. They also gave suggestions on how we should approach this, in which I want you guys to give me feedback, right? Because different, you know, approaches to things come from different perspectives, and you guys all hold different perspectives. Some of those approaches included educating people, obviously, either at a younger age or recognizing that this is a bigger problem than people let on. But yeah, that was what I read, and I thought that was really interesting, and I just wanted to hear everyone else's thoughts on it.
Yeah, I think that's really fascinating, actually. I remember like a couple of years ago, maybe it was a couple of years ago, I don't know if conversations are still being had about this, but a couple of years ago, after some issues within the NFL, I remember there was a conversation being had about repeated concussions, and possibly identifying a new type of brain trauma that arises from repeated concussions, and you know, characterized by some interesting things that may be more difficult to spot than, you know, the types of things that we would associate with brain trauma. So I find this really fascinating, especially because I feel like we don't really, I mean, we do understand how the brain works, but at the same time, I sort of personally feel like it's kind of a mystery to me. A lot of the times when I think about brains, I just think it's like, oh, it's just like a giant mushy, you know, thing in your head surrounded by liquid, and then like a hard shell. And somehow that powers your entire body and does all of the thinking and is you, which is crazy. And I think people also don't realize that it can be difficult when you have brain trauma, because you can have personality changes and things like that, which are really impactful to a person. If your personality suddenly changes when you're like 35 or 40, that can not just impact you, but the people around you who have known you for many years, you know? So I feel like that aspect of it also doesn't get talked about a lot, but I would like to hear what other people have to say as well.
Wait, yeah, I know exactly what you're talking about, because I watched a documentary on it about this one NFL like football player who's gotten to like too many concussions, like too many brain accidents, and basically I think he ended up killing his like wife because his personality totally changed. And the only way you can confirm whether or not he had this like type of brain injury that been caused by concussions is by literally when you're dead, by opening up the brain and seeing the decay that the brain had withstand over time. And so when people like, oh, I got a concussion, it's a serious thing, and I don't think people like realize how serious it is, because it's your brain. It's not just something like, yeah, you have a skull in there, it's protected, but not really. It can like get bounced around, and it can totally like change like the way you think, and like being susceptible to like other, you know, to like more damage to your brain. And so I guess like just what you were saying, Clemmy, like a brain trauma is brain trauma, cancer is cancer. There's no like lesser severity of like a concussion. It's you're messing up your head. And honestly, after I got into my little accident, my biking accident, I am like very wear a helmet, wear a helmet, wear a helmet. Even if you're riding a bike and you don't think you're going to be crashing into something, wear a helmet.
Listen,
Yeah.
I was there for that, and it was
Yeah.
brutal. It was brutal.
I used to do a talk where I'd bring in the helmet from one of my patients that was completely demolished to show what would have been their head had they not been wearing it. And I'm really glad you chose this topic and gave such a great conversation about it. Let me thank you, because I'm a physiatrist, which is a specialist in physical medicine and rehabilitation. And one of the areas of subspecialization that I've worked in for many years is traumatic brain injury. And interestingly, when we were first training many years ago, they used to tell us, well, after 6 months, that's all that's going to recover, because there's no such thing as brain regeneration. And, once people are damaged, they're damaged for life, and blah, blah, blah. And I had the opportunity to work with an amazing man who was the father of brain injury, as well as disability rights movement. And we know this month is Disability Rights Awareness and Disability Pride Month. And that was Dr. Shelley Burrell out in California. I did a rotation with him, and it was incredible to just sit and talk and listen to this man. And one of the things he did was to tell me stories and also let me meet some of his patients, some of them who were, 5, 10, 15, 20 years out, and how incredibly they had recovered, and how he didn't believe any of that. We didn't have at that time the technology to what we know now, that there's all of these stem cells everywhere, and that all kinds of things can happen, and that with the right rehabilitative techniques and fostering recovery, and while minimizing the things that impede recovery. Now, what are some of those things, guys? What do you think impede brain recovery? Let's say you did have a concussion, or you had brain surgery even, or some other insult to your brain. What things are good for your brain? What things are not good for your brain? What do you think?
Overstimulation would probably be not the best thing for your brain. I know when you have a brain injury, it takes time to get back to doing normal things.
Right.
And such as looking at a screen for a period of time, physical activity, most definitely. Yeah, those are just a few. But
well, and there's also like what you put into your body, right? What are some
I
of the
was
things
gonna say, yeah. I
No,
wonder,
you go,
I
Olympia.
would actually like to know, because I think about this all the time, because I feel like, I mean, I'm not even that old. I'm only 23, but I feel like all the time my memory is getting worse. And I'm always wondering, like, is it what I'm eating? Is there a supplement I should be taking? What is happening? And I feel like it makes a big difference.
It's because you're running about 20 screens simultaneously. It's called overload. I'll explain that.
That is true. Yeah.
But getting back to my hypothetical question, but the number one challenge, especially for young people, because the number one substance to abuse is alcohol. Alcohol is a neurotoxin. It is not good for a recovering brain, in which the membranes are more open and things can be more permeable, and it can lower the seizure threshold. It can cause a lot of problems. It can interact with medications you may be needing to take, etc. So leave the alcohol alone. That's number one. Smoking, of course, is not good, because that interferes with oxygenation, and you need oxygen in order for the cells to heal and the body to recover. It also has a vasoconstricting effort from the nicotine. So, you want to stay away from those things that are good for the brain and good for your recovery. Actually, there's something called phosphatidylserine, phosphatidylcholine, which helps to improve those insulations around the nerve cells, and to improve the nourishment that the brain needs. Avoiding too much sugar. Sugar's kind of toxic in a way as well. And definitely, you ever notice if you eat a whole lot of cake and party, ice cream, et cetera, and the next day you kind of almost can feel hungover? The sugar, the colorings, all of those toxic substances, it's a drain on your system to process.
How about caffeine? What does caffeine do to your brain when it comes to
caffeine is a stimulant. And in fact, we use stimulants sometimes as part of the treatment, because one of the problems is cognitive fatigue and lack of attention and inability to sort of maintain sufficient levels of alertness. So it's a two-edged sword, because too much caffeine, too much stimulants causes vasoconstriction and can also raise things up and be agitating. So it's, again, has to be something you look at on an individual case. But I wouldn't recommend drinking it at night, because one of the problems with brain injury, it also can affect your sleep-wake cycle. So getting enough sleep and rest is so important to allow the brain to repair. When you sleep, It's like putting your body in the mechanic shop, I tell people, because that's when you go in and all the good things happen and help to repair it. So fresh fruits and vegetables, antioxidants, vitamin C, those are all good things. Salmon, fish oils, omega-3s, those are really good for brain repair and brain food. Like when I was studying for my boards, my study partner was a Chinese American woman, absolutely brilliant. And it was funny because she and her husband were both Asian, but from different parts of China, and they spoke different dialects. So when his mother-in-law came to visit, she couldn't even talk to her. But she was in there in the kitchen cooking away for us. And she made us like fish soup almost every day. And it was like, because they believe how fish soup is good for your brain, because fish is good for the brain. And actually there's some validity to that, because a lot of omega-3s in fish, and that's part of why we encourage that. So good job. Yay. And traumatic brain injury, there's an organization, Traumatic Brain Injury Association. It really helps support families. I've taken care of a lot of football players. CTE is extremely real. We had the doctor who had discovered it, Dr. Ogdale. Well, I can't say his name properly, sorry, but he was amazing to listen to and what he went through. And that movie was really compelling. If you hadn't seen it, I'd encourage it. It's a great story about he was really looking at these changes and seeing these patterns, and people didn't want to hear about it. Thank you, Dr. Bennett Omalu. All right, thank you guys. Yeah, and sometimes you have to say the right things even when it's hard, and it's hard for other people to hear, especially when there's a lot of money at stake with these guys. But he said the right things, and his stance is that young people, especially elementary school kids, shouldn't be playing football, shouldn't be playing contact, because that affects their development, the brain being injured repeatedly, and a lot of behavioral issues that we may be seeing in children in particular may be undiagnosed brain injury, because it can be associated with something called disinhibition, impulsivity, inability to attend to tasks, anger management issues, memory issues, sleep-wake issues, appetite and feeding issues. It can cause a lot of challenges, but the good news is OT, which is occupational therapy, physical therapy, speech pathology, cognitive retraining, and the proper balance of stimulation and activity over time. And exercise actually is good in a measured way as you build back up, because it helps to stimulate the formation of those new pathways and to bridge over the areas of damage and to repair things. And that's why we talk about exercise in the elderly also, to help stave off dementia, because we know that people who are active, they tend to have better recovery if they do have a stroke, and they also tend to have less incidence of dementia. So I'm hoping that that's true, because I do try to get on that elliptical, and you guys keep rooting for me, okay?
Yeah. I wanted to share
Sorry,
an anecdote about a concussion from a personal friend. He was a college athlete. He was a baseball player, and it was towards his championship game, and he got hurt. And he's a very passionate person, but one thing I recognized when he had that experience is that those emotions were heightened to such a degree that it led to him being really aggressive. And of course, like, I don't know if you guys know this, but there's tests to test how the level of concussed you are, apparently, and also if you're even eligible to go back to playing. And if you don't pass that test, then they don't allow you back on the field. And he was like, he got hurt, and he obviously thought, I'm fine, like, just put me back in the game, like, this is what this is. But as he was explaining this to me, I recognized the change in behavior, because he still wasn't fully recovered by this point. Like, he got sent home because of his level of aggression, but so I could at least tell while he was speaking how quickly things changed. And he's a very logical person too, so it was really weird to see him act illogical, like not normal. And he was like, I told him I was fine, it's okay. And then he took this test, and he was 1 point off. He was 1 point off. And he said some very strong fighting words that day. And so he was speaking to his coach, and yeah, so he no longer plays for that team, and now he works in insurance, and he's a lot happier there, it seems like. But he got really aggressive really quickly, and normally he would be the kind of person to be like, obviously approaching this way is not going to get me the result that I want. Mm-hmm. But you know, when a person wants something, they try getting it. And he really did try getting back on that field. He wanted, because he helped build this team up from the ground up, from like his sophomore year to, because he transferred to his senior year. And he was just so passionate, and it was so sad to see that. But that's a reality of a concussion. Concussions are huge. And I think I remember getting hit myself, and I had a question whether I had a concussion, because of course I've taken these courses, and I was just like, am I concussed or am I just confused? Like, I had to sit there and I had to navigate those emotions too. But then I recognized when someone kicks a soccer ball like 5 feet away from you at your temple, chances are you're not confused. So
Yeah.
It's not an easy thing for the person who is concussed as well, obviously, like, which probably goes with this misrepresentation and the accuracy in numbers in regards to how many people actually get concussed. In the article, it definitely mentioned how people don't even like report that they're concussed, and most emergencies in like the emergency room are concussions, or not most, but like I think the number was like 2% or something along the lines of that. And
that's a lot for any one thing, though.
Severe for an entire population, honestly.
Yeah.
1% is pretty large, but 2% is obviously a lot bigger.
Yeah.
Anywho's, I see we have our guest here. Hi, Vivian.
Hi. Tell me